Perhaps I should back up a little bit, and Linda did start a bit to discuss about getting and sharing information, especially medical information. There are several federal and provincial laws around privacy and medical information. However, there is no legislation that prohibits having a third party, whether that's a spouse, a relative, a friend, or another representative, from giving or receiving information. The trick here is consent. Consent can be implied, which is what happens when the third party accompanies an individual to an appointment or a treatment. Now, you may be limited by space or safety, for example, in an X-ray or nuclear medicine room, or you may be limited by policy that allows maybe one or two others. But if an individual chooses to have someone with them, that is their choice, and it is never prohibited by privacy legislation. If the third party is not present, verbal consent is sometimes sufficient. I'll give you an example. When I finally talked my parents into adding touch tone service to their phone so that they could access their own doctor in the clinic by pressing 2, the phone company would not allow me to alter their service until I arranged a 3-way call and my mother was able to give verbal consent for the change. Often, verbal consent is not enough. If you are told that your request for information requires written consent, ask for copies of the forms that are required. If none are immediately presented, you can make up your own. You will need to include the name of the individual and their date of birth, what information is required and for what reason, with whom it can be shared, and when that consent would expire and how it can be revoked. Now, this may sound daunting, but it can be as simple as a note stating, for example, that Mary Clausen gives consent to Dr. Brown to share medical information with her son, Andrew, and the Sun Life Insurance Company for the purpose of obtaining benefits. The consent would be valid for the next 6 months or until it is revoked in writing by Ms. Clausen. The note needs to be dated and signed, and each party named should have a copy. I highly encourage individuals to keep their own medical records, like Linda was saying. You are entitled by law to all information about yourself. And so even when the numbers in the reports mean nothing to you, ask for copies of your blood tests, diagnostic tests, surgical and pathology reports. Ask with confidence and expectation. Be prepared to pay a reasonable fee, and don't be afraid to say something if you think the fee is unreasonable, and always ask for a receipt. Some doctors' offices have begun to offer flat fees on an annual basis for such services, and while that is a whole new discussion, if you understand who is handling your information and how, and if you agree to that, this should be something you would want to consider. In Saskatchewan, one gentleman was so upset with paying 25 cents for every blood test that he complained to his member of provincial legislature. The MLA stood up in the question period in the House and asked the health minister when he was going to stop nickel and diming cancer patients. The health minister stood up and said, "Done," and that was that. Another gentleman told me his doctor told him he'd have to come back next week because his CAT scan report had not arrived. The gentleman simply pulled out the copy he had gotten from his family doctor and offered the specialist to have a look. They then were able to complete the appointment right then and there. I also encourage clients and their advocates to keep a diary or a journal. Keeping a journal serves many purposes. It's really difficult to depend on your own memory in these stressful times, and keeping track of appointments and phone calls and who you spoke to and what they said is very important. It helps you also to jot down those questions that pop up in the middle of the night, and not only will you get to sleep sooner, having your questions ready will help you make most of your appointment time. A journal will also help you keep track of phone numbers and names all in one place, and maybe help you track little things like how many days it takes the chemo to wear off or how long it takes the anti-nausea drug to kick in. Diaries can also provide a kind of medical history that may be important or of future interest. Research shows us now that many ailments, including ovarian cancer, may have a genetic component. Now, helping a loved one through the day-to-day issues is at most the time at the top of the caregiver's job list, but there are several other big issues that the caregiver is the best person to address. Major illness often throws a family into a state of upheaval. Family roles change drastically, and being away from work can cause serious financial concerns. One young woman called me to discuss divorce because she thought her husband was being distant, uncaring, and unsupportive. He wouldn't even take care of the children during her chemotherapy. After we talked, she realized that she never talked to him about this, and it turned out that he was desperately afraid that she was going to die and he wasn't going to be able to take care of the children. We all need to have family discussions around advanced healthcare directives, living wills, power of attorney, and family and friends can approach these issues with more sensitivity and caring than others. These are the issues that everyone knows about, but we all forget to bring up. And then we all feel better and rest easier when the conversation is at least started. Just a quick minute about having an established power of attorney for financial and medical issues allows another person to pay bills or sign consents when the individual is physically or emotionally unable. And speaking of physically and emotionally unable, a caregiver is often the best person to notice small changes like a new side effect or perhaps even the onset of depression that may require more help. There are countless groups, hotlines, and websites that offer support and in-depth information, and most cancer treatment centers have social workers. There's no reason not to make use of these professionals, but you may have to ask. I've had several callers suggest to me that they feel these referrals should be automatic and mandatory because they just didn't believe they needed to see a social worker. I could talk for longer, but my time is now up, and I will answer questions later and invite everyone to visit the Canadian Cancer Society website, www.cancer.ca, or call our information service at 888-939-3333. Thank you.
Thanks so much, Mary. And now Pamela and finances.
Great, thank you, and I'm glad to be able to join the teleconference today. I wanted to share some ideas and tips that might be helpful to you or for other people you know who may be experiencing some money concerns. So first off, I just wanted to say that if you're leaving work for treatment or staying off work for a longer period of time, it's important to try and investigate all potential sources of income and to learn about them and consider applying. And some of the sources of income include contribution-tested programs, such as CPP disability and employment insurance, sick benefits, because people contribute to those programs when they're working. There could be asset-tested programs, such as provincial and municipal programs, where they'll be concerned about the asset level of the person who's applying. Employer-based programs, such as short-term or long-term disability, and also some personal assets, such as property, savings, and insurance policy, and critical care benefits. Many of the government programs and employer-based programs are a maze in that they have different eligibility criteria, such as the amount that you've contributed, the definition of disability, the length of the employment period in order to qualify, asset levels, waiting periods, and payment periods. Every program has a different definition of disability, and I often call this a limbo bar, where the bar keeps getting lower and lower. And someone may be sick enough to qualify for one program, but they may not be sick enough to qualify for another. Frequently, people may be ill enough to qualify for EI, employment insurance sick benefits, but they may not qualify for Canada Pension Plan disability. And as well, some people qualify for Canada Pension Disability, but may not qualify for the disability tax credit, and that can make things very confusing. I think it's definitely people need to talk about their financial concerns and not to keep them private, and especially to seek out someone who might be able to help.